Hey, it's Dr. Adam Nally coming to you at lunchtime today. I have had a lot of patients asking me about female hormones, especially estrogen dominance, and the effect of estrogens and progesterones on weight loss. What I wanted to talk about today is a little bit, it specifically is about estrogen dominance, but I'll touch briefly on some of the things that I see commonly. The most common challenge I find with people losing weight in my office is that they're insulin resistant. And if we don't fix the insulin resistance first, we can't address really anything else. We got to fix that first. You can address the hormones like progesterone and estrogen separately, but you really won't see successful weight loss until you actually lower the insulin first. The second piece that's essential is thyroid, and I've addressed thyroid at other times, and I'll address it in other videos as well in the future. But second issue is thyroid. You got to fix the thyroid second. So fix the insulin resistance first, fix the thyroid second, and then third, we look at the sex steroids and the sex hormones. And so we're going to talk today a little bit about this estrogen dominance issue and how it relates to the sex hormone pathways in the body and what that means. Let me tell you a little bit about who I am. My name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I've been in practice in the Surprise, Arizona area for almost 20 years and have been doing a ketogenic lifestyle myself and with my patients for about 15 of those years. This video is currently on live stream right now on Facebook Live. What I'll end up doing is rolling it over to YouTube probably in about 24 hours. So if you see it on live stream here, great, fantastic. Then we'll roll it over to YouTube, so it'll be available there to see. And as you guys are signing in, I appreciate it. Thank you. We're going to, the high reverse T3 and those type of things I've addressed actually in a video before, Marnie. So I'll say we'll have you look at those videos that are on my YouTube channel. There's one I just did about thyroid, and it talks a little bit about that. Talks a lot about that, actually. And so I'll take some of the comments at the end of this. But what I wanted to go through some estrogen dominance issues and answer this question because I've had so many people with challenges that way. Hey, Angela, how are you? So first, let me show you what the sex steroids are, and I'm gonna shift screens here so you can see this. This is the sex steroid pathway, and what I want you to see, if you can see my cursor, is that we make our sex hormones, specifically progesterone, estrogens, and testosterones, basically from cholesterol. So our body has to have fat, and this is where I find a big challenge with patients who are doing vegan or vegetarian diets, is they don't actually get animal-based cholesterol. Plant-based cholesterol does not give you all the components necessary to truly make the sex hormones appropriately. So cholesterol is converted into pregnenolone, and then it's converted into progesterone. And for a female, the progesterone to estrogen ratio is essential. If that ratio is off, you can see a lot of challenges. And one of those things we're going to talk about is what's called estrogen dominance, where the person's making progesterone, but they have a whole lot more estrogen present that's causing a challenge. Now, progesterone is converted into 17-hydroxyprogesterone, and then it's converted into androstenedione. That's then converted into testosterone, and those both can make the three estrogens that are essential as a female and a male as well. Women just have a lot more estrogen, and men have a lot less estrogen with a lot more testosterone. So, but this is the pathway in regards to how the body processes this, and it's really important that we understand that. We understand what this really means. So let me look. So for a moment, as we go, oops, let me change screens back here so you can see me. So for a moment, what I want you to look at is what happens if one of these is too much, if there's too much of one or too much of the other. And so what I'm going to do is I'm going to pull in here estrogen dominance, which is a term you hear a lot, but what that really means is excess amounts of estrogen. Now, the estrogen progesterone ratio in a female is really important. It's also important in the male too. But if you have excessive estrogen present, and there's reasons for this, and we'll talk about this in a minute, you're going to see the following things happen. You'll have irregular bleeding, you'll have breast tenderness, you have depression, fatigue, and poor concentration. You can have fibrocystic breast disease, PMS, your libido will drop. You can actually have fibroid tumors grow in the uterus. This is usually one of the major causes of uterine fibroids. Endometriosis is driven by this hugely. Water retention, bloating, the weight gain around the hips and thighs is driven by too much estrogen. And then uterine and breast cancers are usually driven by excessive estrogen. And what I'll do is I'll pop this up on the screen here so you can see it a little more predominantly, and you can take a look at that if it's harder to see on your phone or on your smaller computer screen. But when your estrogen level's too high, in proportion to the progesterone, you're going to see these things happen. And I see these happen all the time. I see these happen in women who are doing low-carb diets as well, because for one reason or another, you may actually see a dominant presentation of estrogen. So what happens though if you have estrogen that's too low? If your estrogen levels is too low, well, you can actually get the opposite. You'll see vaginal dryness. You'll see a decreased libido or sex drive as well. You'll see disturbed sleep, poor concentration. You can actually see depression also from that as well, and thinning of the skin. And so that's important. You recognize that. If your progesterone is too low, it can look a lot like excess estrogen. And so one of the reasons I'm a big fan of checking the hormones and not just assuming, oh, you're in menopause or you're perimenopausal, is that are you low in progesterone or are you high in estrogen? Because we want to treat them slightly differently, dramatically differently, because we're going to look at using a different approach to the hormones to do that. But progesterone deficiency has all of the same presentations of estrogen dominance or excess estrogen, but you'll see hair loss and you'll see bone loss in progesterone deficient female especially. You can see it in men too, but that's something that's important. So looking at the female hormones is really, really important. Getting a test to see what they are. Now, the most effective way to test these is a salivary test. Some insurances cover that, some don't. You can kind of ballpark the numbers with blood testing, and we do that a little bit in my office. But to be really, truly effective, you've got to do the salivary testing to see this really effectively. You can do urine testing too. Some insurances will cover that, some won't. But it's important to look at that. Now, what happens if you've got too much progesterone? Well, it can make you feel euphoric, and you'll feel great, and your skin will look nice. But when that progesterone stays high for prolonged periods of time, and this is what happens when we give women too much progesterone for over a year, the body actually upregulates progesterone receptors, and it leads to then symptoms of progesterone deficiency, just like you saw on the previous screen. And so that's one of the challenges that happens if we're not appropriately addressing those types of factors and looking specifically at is it low progesterone, is it high progesterone, is it low estrogen, is it high estrogen. So those are really, really important. Just Jen asked a question, what's the ratio? Well, the ratio is a calculation, and there's a number of ways to calculate it, but the ratio is usually a calculation of two of the three estrogens added together and then divided by the progesterone, or a flip, progesterone multiplied by 1,000 divided by estrogen. And I can actually show you those calculations here. I think they may show up on this next slide screen. Let me see here. If you're one of those that wants to see, let me go back here to the right screen. Flip to the right screen here. Let me show you this slide here, as if I can switch into the right screen. Slide. So usually for someone to be feeling well, your estrogen 1 needs to be less than about 200 picograms per milliliter. Estradiol somewhere around 90. These are ideal levels that we want to see progesterone at, and estrogen. Progesterone for a female about somewhere between 5 to 7, pregnenolone about 100. And then the ratio of estrogen to progesterone should be less than 250, or if you do the inverse of that, the progesterone to estrogen ratio should be somewhere between 100 to 500. Those are the numbers that you want to look at specifically. Salivary testing, Jessica, can run anywhere from $100 to $600, depending on what you're checking and how long they do the checking for. So those are some great questions that are important there. So let me pop back up here and then find the next slide set so I can show you what to do, what you need. I know Jen wanted to see specifically the calculations. And so this is how I calculated up for the estrogen progesterone ratio. You're going to take estrogen 1 and estrogen 2, and you'll divide that by progesterone, and that gives you the ratio. For the opposite, you use progesterone times 1,000, and you divide that by E2, which is estradiol, and that gives you a range. Now, if you're estrogen dominant, you're going to see that range less than 100. If you're progesterone dominant, you're going to see that range greater than 500. And so we calculate that up, and that's one of the things your doctor should be doing and should be looking at to give you some idea and some help that way. So what do you do? Well, why? And today I'll touch on the other issues with low or high progesterone in other videos. But what I wanted to talk about today is why do I see a predominance of estrogen excess, or why is there so much estrogen dominance that we see? And one of the big issues is something called xenoestrogens. And so xenoestrogens are there's like 50 different chemicals that imitate estrogen that we get exposed to and have a pretty powerful effect on our body. These chemicals can actually have 100 to 1,000 times normal effect than regular estradiol, which is one of the more powerful hormones or forms of estrogen in the body. And so it's important to understand that we get exposed to these all the time. And even if you're doing a ketogenic diet and you're getting exposures in these ways, your estrogen level may be too high for your progesterone ratio. So that's actually really important to understand. And it's important to look at. Let me make sure I got my screen here so we can see now. What are the 10 most common causes of high estrogen? I won't go into these in heavy detail because these are things that could each take its own video by itself. But I want you to be aware that there's a number of things that can do this pretty significantly. So number one, and let me make this clear here, the 10 most common causes are bovine growth hormone that's found in commercially raised meat. One of the reasons a lot of the people talk about using grass-fed beef is that you're going to see much less use of bovine growth hormone. The bovine growth hormone, it basically has an estrogen-like effect on the body and can actually artificially raise your estrogen if you're using large amounts of commercially raised meat and dairy products. Insecticides or pesticide residues, many of these can act like estrogen as well. If the tap water that you use or have has petroleum derivatives in it, those petroleum derivatives can actually act like estrogen. Paraben is a really common chemical found in shampoos, lotions, soaps, toothpaste, and cosmetics. And amazingly, 100% of these xanthogens that are actually in the paraben actually are absorbed through the skin. And so it's important to recognize that. One of the things that we see in Arizona, because it's so hot here, is the use of these plastic water bottles. The softer the plastic, the more phthalate is in that plastic, making it softer. And the challenge is when that phthalate or that plastic is heated up, when the plastic's heated up, the phthalate is released into the water. Well, that phthalate acts as a xenoestrogen and actually stimulates the estrogen receptors. Or if you've wrapped your food in plastics and then microwaved that food, that becomes a big challenge and the estrogen levels will go up and your body will respond as if you have a high estrogen level. Artificial sweeteners, including MSG, have hormones and chemicals that act like estrogens as well. And then if you're using a lot of canned foods, they will actually line the inside of the can with a plastic coating called BPA, and it's not used as much, but it still is being used, or bisphenol A, and that acts just like an estrogen as well. One of the reasons I'm not a big fan of using soy protein isolate as one of the protein powders is that the soy proteins, specifically plant estrogens, they're found in really high amounts, and those will actually stimulate the estrogen receptors in the body and can become a problem. Dryer sheets. The dryer sheets make your clothing feel so wonderful and nice, but those xenoestrogens actually penetrate through the skin when you've used lots of dryer sheets, and that can play a role with high estrogen levels. And then birth control pills can do the same thing, as well as some of the chemicals that are found in tampons and sanitary napkins that women are using through their time of their cycle. And so all of these play a big role in artificially raising estrogen levels in the body. Now, somebody says, well, there's nothing that's good for us anymore. And so I'm not saying just run out and take all this out of your house. What I'm saying is that if you have symptoms of estrogen excess, it may be that you're using one of these type of products that's causing you to have a challenge. So you may want to look at, do you want to take the soy out of your diet? You may want to use the softer plastics less often. You may want to use paraben-free shampoos or lotions. Remove those out of your diet. And if you have access to grass-fed beefs rather than the commercial beefs or foods, you may want to consider doing that too. I'm not a fan of just taking out everything and becoming a caveman. But what I'm saying is that oftentimes I'll have people come into me and we just identify that there may be a couple of these things, one or two of these that you can eliminate or change and have a dramatic improvement on the estrogen level in your body. So something to consider in that regard, something that may be helpful that way. What other things can actually raise the estrogen? Well, I had a patient ask me the other day, I'm doing all the things I'm supposed to be doing, Dr. Nally, but yet I still have this high estrogen and I don't understand why. So let me show you some other common causes. These are 8 particular things that could be a factor in raising that estrogen artificially. If you're not taking in enough omega-3 fatty acid, the omega-3 fatty acids actually suppress the aromatase enzyme in converting androstenedione to estrogen. So if you are converting too much estrogen by yourself, you can actually suppress that just by increasing the omega-3 fatty acids in your diet. That's why it's so important to use some of these omega-3s in the types of foods that you're using, looking for foods that contain those. Second, exercise actually decreases estrogen by itself. And if you are very sedentary, and I have a lot of patients that can't really exercise heavily, and they will have their estrogen levels will go up. If you can do some form of physical activity, you're going to see an improvement in your in your estrogen levels significantly. Obesity drives the process of increased estrogen production and increased testosterone production in the female. And then fatty liver disease, which I see in at least probably a third of the patients that have insulin resistance, that fatty liver disease slows the metabolism of estrogen in the liver and slows the clearance of estrogen from the body, and so that estrogen can stay high. If your vitamin D level is low, it can do it. Alcohol actually shuts down the conversion of estrogen in the liver as well. It actually changes the way that aromatase enzyme is being used or worked on, and it actually keeps the estrogen levels high. So if you're having a drink or two every night, even though it may be your low carb, keto friendly alcohol, the alcohol itself, it's not the carb that does it, but that alcohol itself actually is playing a role. Smoking does it. We've known that for many years. And chronic stress will raise the cortisol. That actually lowers sex hormone binding globulin, and it actually allows more estrogen to be free and available to your body to use. And so those are all potential causes that may cause or raise that those estrogen levels. And so that's important for you to be aware of. So what exactly is happening in the female? And let me see if I can show you this without being too crazy here. Let me do it this way, actually. So this is inside the ovary of the female. Your cholesterol right here is actually, maybe I'll put it up this way so you can actually see a little better. So your cholesterol is converted into these hormones, and then androstenedione is used to either convert into testosterone or convert into estrogen. And if you shut down this aromatase, you can actually slow the conversion of estrogen. But depending on the type of activity, we showed that it actually increases the production of estrogen, and you actually have this amplification of estradiol or estradiol being present. So something to consider there. Now, how does insulin play a role on this? And let me just show, insulin actually amplifies the conversion of progesterone to 17-hydroxyprogesterone. It amplifies the conversion of androstenedione. It actually amplifies the conversion of androstenedione to testosterone. And so it plays a role in lowering estrogen, but it causes weight gain, and that weight gain actually can increase estrogen by itself because of the retention of the fat and the estrogen binding to those things as well. Increased insulin slows the production of luteinizing hormone, which then adversely affects the fat cells, lowering adiponectin, either raising or lowering sex hormone binding globulin, depending on a number of factors, and can either increase testosterone or increase estrogen. So these are some things that are really important to understand in this process in the cascade of conversion of your hormones, cholesterol, into progesterone, testosterone, and the estrogens that are there. So that's essentially what estrogen dominance is. You have an overproduction of estrogen in the presence of progesterone. So if you're one of those patients that has that, what we want to do is check the hormones, number one. Number two, we want to figure out, is there a way we can actually prevent that estrogen from converting? Is there something you're doing in the environment that may be playing a role there? Or is it related to food or medicine you're taking, or is there something that we can do that we can add on? Can we increase exercise? Can we change some things that actually may play a role in improving that estrogen dominance? So hopefully that's going to give you some ideas to what estrogen dominance means and why you might have estrogen dominance even if you're doing a ketogenic lifestyle. One of the things that I find with the carnivore diet is when you lower and take out all of the leafy greens, those leafy greens are essential in the formation of bile. And you clear estrogen from the liver by dumping it into bile, and then bile clears it. So if you're one that's estrogen dominant, I don't recommend a carnivore diet for you. I recommend a ketogenic diet with a leafy green salad every day. If you are one that is progesterone dominant, we may actually do the opposite. We may want you to do carnivore to actually shift that. Or if you have PCOS and your testosterone is too high, we're going to do the opposite. And you may actually do better with a more carnivore-based diet because you're going to see that estrogen linger longer. So that's how we actually kind of balance that out. And that's why some people do better with carnivore and some people do better with just plain keto, because of the way these hormones are being affected by the food you eat, by your genetics, and those kind of things. So I hope that gives you some insight into what's happening with that part of it and how we can actually affect it. So step one, follow a ketogenic diet. Step number two, make sure your thyroid's correct. Step number three, get the hormones checked. And then based on where those hormones are, we can either replace the hormones, we can do some things to either increase or decrease one or more of those hormones that may be necessary. I'm a big fan of bioidentical hormones. I don't use the commercial or pharmaceutical hormones any longer. And that's a whole other topic and reason for that. But something to be very aware of and be very clear on. My name is Dr. Adam Nally. I'm a board-certified family physician, a board-certified obesity medicine specialist. You're seeing this probably right now if you're live with me on Facebook Live. So if you haven't liked my page at Dr. Adam Nally, please like it. And then within 24 hours, I'm going to roll this over to YouTube. So you can go to my YouTube channel. That's youtube.com/Dr. Nally, Dr. Nally. And I have a whole, all these videos are going to roll over there to YouTube, and they'll be there available to watch there. If you haven't gone to my YouTube page, please go there now and subscribe to those videos, because when the new ones pull in, they'll pop up there. I'll try to answer a couple questions. I'm in between patients here at lunch, and so I'll see if I can scroll back and see if there's a few questions I can answer about this topic. If it's about another topic, I may defer you and do it at a different time. But hello, Belinda, how are you? This is fascinating, isn't it? Let's see, 11 years postmenopausal, do my ovaries still do anything? You know, Patricia, some do and some don't. I'm going to try to see if I can pull your question up on the screen here. Patricia says, 11 years postmenopausal, are they still functional? Some women have some and some don't, so that's why we check. And if you're symptomatic, you know, you may very well want to get those checked out and looked at. So something to be very aware of. Let's see here. I just got my cholesterol back. Cholesterol's 365, LDL's 264, triglycerides 153, HDL 70, keto for 10 minutes. My concern is let me shift this up here. My concern, Debbie, is that your triglycerides are still too high. They should be less than 100. So if something's driving up your insulin still, that's something that you need to talk with your doc or me about individually, and then we can talk about how to identify that. Faith that says, is anything safe anymore? Well, yes, things are safe, but the question is, what are those foods doing to you? And this is why, if you're not seeing success with your goals in a ketogenic lifestyle, we need to look closely at those hormones, because it's not just the fat and it's not calories. This is actually an issue of hormones, and so that's important. And she said, this isn't likely in postmenopausal women. It's actually very likely in postmenopausal women. I see this really commonly in postmenopausal women because progesterone will fall notably in postmenopausal women. And if they're exposed to these xenoestrogens, they'll become very estrogen dominant very quickly. So yes, it's still an issue. Jen says, my estrogen skyrocketed using soy. That's why. Get rid of the soy bars, get rid of the soy protein isolate, get rid of the granola bars. They put soy in everything. So Jen, very, very true. Very good point. And it's something I see commonly. I had one lady that had an estrogen of 600, and it was because she was using soy protein isolate in one of her protein powders. Use real food. Stop using this soy garbage. How do I feel about chia and flax? Why would you need it? There's no need to put in chia and flax if you're getting your omega-3 fatty acids from fish oils, or from MCT oil. The only reason to add flax is if you're horrendously constipated and you need the fiber. That's really the only other reason I would push it. I really don't think it's that important. Seems there's nothing good. Oh wait, that's the same question there. We'll pull this up here. Let's see. At what age should women start getting their hormones checked? Ruby, I would say at any age that you're not able to obtain the goals with your dietary approach, or you're feeling any of those symptoms I showed you previously, and they need to be evaluated. Jen says, awesome. That's a little earlier. Great. Fantastic. How do you know if the estrogen ratio is too high? I showed you that. Hopefully that gave you an answer to that there. So let's see. Sarah says, I'll spot for 8 days before I start my period. That means that you either are estrogen dominant or progesterone deficient, Sarah, and you need to get checked out. So have your doctor check those out, or go to someone who knows how to check them and how to treat it if it's there. There's actually, there are actually a number of hormones that need to be checked. Number one is progesterone. Number two is testosterone. I like to check both free and total. And then there are 3 different forms of estrogen. I look at 2 of them specifically. If your doctor doesn't know there's 3 forms of estrogen, you need a different doctor to check the hormones. You need someone that understands all three estrogens and how to address them and what to do with them. I'm going to just scroll back up here and just show you briefly, if I can do it. I may not have it listed in this slide deck, but that's the key. So these are common. Let me just show this to you here. These are common. Let me go. There we go. Oops. There you go. Hopefully you can see that, and I'll take her comment out here. Oops. If I can get my mouse to work, I'll pull her comment off. All right. Let me close that. All right, so these are common levels that I'll check in my office. These are the ranges that we'll often use to look for. Estrone is estrogen 1, estradiol is estrogen 2. These are the 2 that I'll check. Estrogen 3 is considered more of an experimental component, and so we don't don't check them as often. But these are the hormones that I will commonly check in my office, and I'm looking for markers to both with men and women, and these are the ranges that I try to shoot for, just so you're aware of. This is something that these are kind of my ballpark numbers that I'll use in my office. Hopefully that'll at least give you some ideas to the hormones that I'm looking at. But those are the ones that I look at and I'm looking for specifically. Elizabeth says she lives in Ecuador. Where can I order my own labs? I don't know in Ecuador. That's a good question. I don't know, and I don't know the Spanish names for those. I wish I did. I apologize. Amy said, yeah, Amy, you'll want to rewatch the whole video because we talk a lot about estrogens and progesterone, and specifically estrogen dominance in this video. Can you stop taking a statin cold turkey? Yes, you can, Martha, but you want to make sure you know why you're doing it and someone who's monitoring you to make sure your risk is appropriate in that regard. So I would talk with your doctor about what the pros and cons of that statin, what to expect if you do and don't. Let's see. There's Faith, there's not really a panel to ask for. You have to know what you're looking for specifically. So there's no panel. I have to order these tests individually, and I order them for a specific reason based on specific symptoms. So testosterones, progesterones, estrogens, and a number of the other sex hormones. I'll show you here for a moment. Let me switch to this screen. Let me go back to this screen here. So, and I'll show this to you here. These are the sex hormones. Let me set them up this way. And I'll take her comment out. These are the sex steroid pathway. Any of these hormones can be checked, and there are reasons to check them. The ones in yellow are the ones that I'll commonly look at most often, but your doctor needs to know why they're looking at them and then how to address them once they order them. So just ordering them to order them, unless you know what to do with them, it really doesn't help you or I much either. So let's see. Kara says, I was bleeding heavily, super plus tampon overnight, soaked less than 2 hours. Had hormones checked. She said my progesterone was low and thyroid borderline and vitamin D extremely low. Put me on mini pill, high vitamin D and small amount of thin thread. I told her I also do keto. So Kara, one of the things that happens is you've got insulin resistance issue. You have a thyroid issue and a female hormone issue. So it's important to look at. Oops, pardon me. I get it closed. There we go. It's important that you're using keto, and then we're addressing the thyroid, and then we're addressing the hormones. And then these hormones will flux within 2 to 3 months, and so they need to be reevaluated and rechecked. So make sure you're following up closely with your doctor to have those evaluated and make sure that those hormones are actually effective, that the doses are correct, because we change those doses every 1 to 3 months based on how rapidly they change. And so keeping a close eye on it is very, very important. And if you're still having symptoms, Kara said she's still having some symptoms, then you want to follow up closely with her every 1 to 2 months to make sure that those hormones get adjusted correctly. Because that's, if we go too fast, if we go too far too fast, we'll make you feel even worse. So those are some important things to look at. Mary says, interesting. I do find that you're better on keto carnivore with moderate protein and have PCOS and Hashimoto's. So that's why, Mary, with PCOS, you actually will do better on carnivore. And I find that the case with a lot of women who have higher testosterone levels because they need that carnivore level not to actually help shift their estrogens back up. And Kara says she's going to have hers checked in June again, her levels. That's great. Fantastic. Let me go back here and see. You guys have some amazing questions. Let's see. Jamie says, this is very interesting information. Lost interest after switching from keto to carnivore, but may have stalled. Maybe need to add greens back in. Well, Jamie, one of the things that I tell people is if you're stalling out, we want to know, are you, number one, are you in ketosis and is your insulin low enough? Number two, where's your thyroid? And then number three, is there a estrogen or progesterone issue that may be playing a role with this? Oops, if I can get it to close. There we go. All right. And then let me go back and catch a couple of more questions here. I think I got all the questions there. Fantastic, guys. You got some great questions tonight, or today. I guess it's today here in Arizona where I'm at. And that was, we already talked about Kara's. Okay. Again, my name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist, and been in practice about 20 years here in the Arizona area. And Amy says, would Mirena IUD play into estrogen or progesterone dominance? Absolutely, it does. One of the challenges I find with Mirena is it's got a progestin, not a progesterone. The problem with synthetic hormones like progestins is that they work on the bottom half of the body, but they don't work on the top half of the body. So your uterus will be happy, but as you see, progesterone needs to be converted into cortisol and DHEA and testosterone and estrogen, and your body cannot convert the progestin into the needed hormones and cross the blood-brain barrier. And so one of the problems I find is that a lot of women will feel better from the bottom half down, but they won't feel good on the top half. So they'll have anxiety, depression, poor sleep, hair loss, because their bodies thinks it has the progesterone it needs, but it doesn't, because progestin, which is a synthetic hormone, cannot be converted correctly. And that's why I'm a big fan of bioidentical hormones, not of the regular hormones, because they are not the same. And this information in Faith is not in my book. This is new information that we're learning in the last 5 years. I have had some labs tested and have low progesterone. So Sarah, you want to have that addressed by your doctor. Mary says keto for 3 years, paleo for 3 years prior. Eating too much protein converts to gluconeogenesis. So Mary, I'm not quite sure what that comment is related to. Well, too much protein can play a role in inhibiting your weight loss if you're still overweight or obese. If you've thinned down, you may actually need more protein to maintain that muscle mass. So there's some variability in that statement. So I don't just use that to spam it across the board, but there is some variability. And yes, Faith, it is time for another book. This is one of those things that I'm looking to put together in another book here and go forward with. So it's great to see you guys this afternoon. Hopefully this gives you some information about estrogen dominance, estrogen progesterone, and how it relates to a ketogenic lifestyle. Catherine says, I'm 58, doing keto since August, wondering if my body has normalized hormones, as I've had no hot flashes since eating keto. So one of the amazing things, Catherine, is that oftentimes just fixing the insulin allows your body to self-correct these hormones. And I've had women dramatically improve and don't need to have anything adjusted because keto was all they needed. But there are those others that they need to have the thyroid fixed. They need to have the sex hormones adjusted or addressed. And so something to look at. So consider yourself blessed there. All right, I probably have to go see patients now. So I'm going to sign off. But again, my name is Dr. Adam Nally. Please subscribe to my page. So go to youtube.com/Dr. Nally, Dr. Nally, Nally, and register, subscribe to my page there. Check out the videos that I have there. This will be added to it in the next 24 hours, and we'll go from there. So remember, keep the fat high, keep the carbs low, pass the bacon. Have a good afternoon. Take care, guys. Bye-bye.